Hello and welcome to yet another episode of Dr. Sin. Today we have a special guest. He is the MD and Director of Infertility and Fetal-Maternal Medicine at Sunrise Hospital, Kasaragod. He is also a specialist in obstetrics and gynecology at IMH Hospital, Dubai. Let us welcome Dr. Raghavendra Prasad to the show. Welcome, Doctor. So first of all, before going deeper into the subject, we would like to know more about your early education and career life.
I have basically done my undergrad from Mysore and my post-graduation was from Chennai. And I've been working as a consultant in this field for the past 8 years at Sunrise Hospital, Kasaragod.
And how and when did you find your interest in the area of gynecology?
I wanted to be a gynecologist right from, I think, from my 10th standard. I mean, that was probably since my mother is a gynecologist, so when we were seeing her, I thought I would have developed the interest. I did not know, but from the very first day of my MBBS life, I always wanted to be a gynecologist.
Okay. And coming into the area of gynecology, firstly, we'll take a case of a pregnant woman. When should she schedule her first prenatal visit?
See, basically what we say is as soon as you become pregnant, because so there are so many things which can go wrong in the first 3 months. So normally we say as soon as you become pregnant, we need to consult your specialist. And from then onwards, we normally do the antenatal checkups once every month, probably till they reach around 34 weeks. And then we go around once in 2 weeks. And as they near the date of delivery, we need to follow them up every week.
What is happening right at the moment in the Department of Gynecology and Obstetrics?
So the Department of Gynec and Obstetrics is advanced forward so much. We have so many other fields right now. It's not just Gynec and Obstetrics. You have infertility, you have fetal-maternal medicine, you have robotics, you have high-risk pregnancy, and you have Gynec oncology, Gynec urology. So it's the basic obstetrics and Gynec has now been spread into a lot of other fields now.
And coming back to a pregnant lady, what are the food which she has to avoid and what are the food which is advisable during
basically, there are no food restrictions as such. I mean, a lot of old regulations, I mean, people used to say that you cannot eat this, you cannot eat that. But as of now, we do not follow any of those. But what we normally see is when you are pregnant, you tend to get a little bit of more of reflex esophagitis, I mean reflex gastritis, everything. So we advise them generally to avoid spicy food. But rest anything, plenty of vegetables, nutritious food is must. Not the junk food, but we do advise them to go in for a lot of nutritious food like vegetables, proteins, sprouted vegetables and all those things.
Till what time is it safe for a pregnant woman to travel and do exercise during pregnancy?
Basically, see, what we say exercise, travel, when you take into consideration, it's the first 3 months, which is the critical period. So excessive traveling or any destabilization during these first 3 months usually tends to be a little harmful. So we normally advise them to travel after 3 months. And then the difficulty in travel comes around the period of confinement, because any strenuous journey or any too much of traveling during the last phase of pregnancy, maybe the last 2 weeks or 3 weeks, again can have some kind of detrimental effect. So that's why we normally advise them not to travel for the first 3 months, and then the last month to be a little careful. But there's nothing like you cannot do this, you cannot do that. It's only thing you need to be careful. But you need to be really careful during the first 3 months.
Now coming to the area of infertility, we do hear a lot of cases of infertility right at the moment. So what is the reason for this?
See, what we have, the literature has told us that as from what it was in 2000 to what it is now, there is a tremendous decline in the fertility capacity. When you take into account the men, the semen factors in the males have come down drastically in the past 15 years. What was considered as abnormal in the year 2000 is now considered normal in 2015 because it has reduced so much. Now, why has it has reduced? Well, one thing is possibility because of the type of food habits we have. We eat a lot of junk. Guys drink a lot, smoke a lot, your lifestyle is different. You have an extremely stressful lifestyle, too much of exposure to radiation through mobiles and computers and all those things. So maybe all these things over a period of time has brought about a gradual decline in the quality of a semen in the male. When you look at the female per se as such, again, one, you find that most of them delay their age of marriage till they attain job related whatever they dream of. So the age of marriage is delayed. Again, unhealthy lifestyles in the women. They put on obesity, when they put on weight, all these things tend to have some kind of effect in their ovulation status. So when you put these two together, we do find that more and more couples are having difficulty in producing a child.
Could you tell us more about IVF?
IVF per se is a broad terminology which is called in vitro fertilization techniques. Now, for people who are having difficulty in having a child, what we say is the final solution is basically for IVF. People whom you suggest IVF is one who have crossed their age of decent chance of having a child, say cross 35, 36. Or if you have other factors which have compounded their chance of having a child. So IVF per se is where we give medicines to the lady and we develop her eggs, follicles or what you say, and then through a surgical procedure, we just retrieve those eggs out. We take the husband's sperm and with the help of an equipment, machine, we inject the sperm into the egg. And once the embryo is formed, we transfer the embryo back into the uterus. This is basically called as IVF. The procedure which I told you is called ICSI. Now we've gone one step further to a procedure called IMSI. IMSI is a procedure where now if you have a male who has got defects in his sperm, so what we can do is we can identify through a microscope which is the normal sperm in the jumble of sperms, select the best sperm and then inject it into the egg so that we tend to get a better result in people who are men who are having abnormal sperms. So this is basically about what, in a nutshell, of what IVF is about.
So the latest advancement in IVF is
You have IMSI, we have something called as time-lapse monitoring. What is called as time-lapse monitoring is basically when once the embryo is formed, but from the time we do the procedure to the time we take the embryo and put it into the uterus, it is kept inside the incubator. Now, what are the changes which are happening inside, we do not know. Now, when we see the embryo on that particular day when we want to transfer it under a microscope, we see that, okay, this embryo looks good. But in fact, it may not be good because there might have been some changes which has occurred during those 48 hours, which may suggest it's not a good embryo. But when you see it, it looks good. So with the help of time-lapse monitoring, it's something like it's a 24 hours non-stop video recording. So we get to review the growth of the embryo in all the 48 hours and you will not miss even a single step of what has gone wrong. So by that method, you will be able to select the best embryo for transferring it into the mother.
I recently heard about gynecologic cancers. Could you tell us more about this and why this happens?
See, gynecological cancers, when you take into account, you look at the system of the female genital tract. You have the vulva, you have the vagina, when you go from down to up. Then you have the cervix, then you have the uterus, then you have the fallopian tubes and the ovary. So cancers can affect any of these parts. So when you look at from the lower part, you say vaginal or vulval cancers. Commonly the patient will present with excessive discharge or foul smelling discharge or itching or a swelling or a mass. Go one step up, you have the cervix. Even cervical cancers will present with irregular discharges, and when you examine again, you can see a growth in the cervix. Now, cervical cancers commonly will have bleeding associated with it, like postcoital bleeding or something like that. Uterus, again, will have bleeding disturbances. The silent and dangerous one is the ovary. Because the ovary will not give you any symptom. By the time you diagnose that there's an abnormality there, it is actually either too late or something like that. So, fallopian tube also, again, the tumors of the if you have a cancer of the fallopian tube, you will have excessive and foul smelling discharge. So, you actually need to investigate them thoroughly. And Right now, I think in the present market, you have vaccination available for women of childbearing age or as soon as they have crossed their period of obtained their menarche. Vaccination for cervical cancers, because it is found that cervical cancer is one of the growing causes of death all over the world in women. So now this vaccination has been recommended as a part of the schedule in vaccination of girls with your regular immunization schedule. This vaccine is also being recommended.
Okay.
So with the use of this vaccine, the incidence of cervical cancer probably will come down in the years to come.
And why is this happening right now in women?
See, it's not that it's been happening previously also. Probably with the advances the medical sciences has made, the rate of detection is pretty much earlier and pretty quicker. So we are able to detect things at earlier. We are finding that the incidence is increasing.
And what treatment are given right now?
Treatment can range from surgery to radiotherapy and chemotherapy. That's the only treatment. Early stage cancers, whichever the area is involved, the early stage cancers, if detected at a very early stage, it's very simple. Only surgical management should be enough. But as the stage advances, along with surgery, you will have to go in for radiotherapy or chemotherapy, depending on which part of the female genital tract is involved.
How and when should a couple visit a doctor when they find out that they are having some problem in having a baby?
So basically, we normally allow them to try at least for a period of 1 year. Now, 1 year is the time which we state that the couple have to be together throughout for that 1 year. Only then we start investigating them. In some countries, they still extend the period up to 2 years because they've found that at the end of 2 years, even 60 to 70% of women will end up becoming pregnant. So, but it varies from countries to countries. But generally, we wait at least till they complete 1 year, and then even after that, she's not become pregnant. We start investigating.
What are the basic tests given when a couple enters or comes to a doctor?
When you see a couple in front of you, maybe after 1 year, the investigations per se will be divided for the male and for the female. Now, for the male, the only criteria which is there is a semen analysis. And based on how the semen parameters are, we will advise them on further investigations. Now, when you look at semen parameters, there can be sperm or there may not be any sperm. Now, if there is no sperm at all, so there can be a problem with the production of the sperm, or there can be a problem for the sperm to come out. So there might be an obstruction somewhere. In such conditions, we do investigate further. We will be doing a hormonal analysis called FSH for the male.
Okay.
And if there is some abnormality in the production of the sperm, that FSH value will be very high. Now, if it's an obstruction, the FSH value will be pretty normal. And we will be able to advise them to go in for IVF.
Okay.
Now, when you look at the female per se, we have to evaluate 3 things. 1, how her uterus is, how the inside of the uterus is, how her fallopian tubes are, and how our ovaries are. When you look at a female from the ovary point of view, if she is having a cycles every month regularly, her ovary tend to be normal. So we need to do a basic ultrasound. We do a basic ultrasound. We are able to identify if there's any defects in the uterus, if the uterus is having any growth, any fibroid or something, if her endometrium is normal, and if the ovaries are normal. Now, tubal evaluation is done by there are multiple procedures. One is called an HSG. It's an X-ray of the tube. Or we have another procedure called as sonosalpingography, where we inject fluid into the uterus and see the fluid coming out through the tubes with the help of the ultrasound. So these are the basic tests which a lady should have once we start the treatment for pregnancy.
You have a new thing in gynecology called robotics. Could you tell us more about this?
See, robotics is a field where instead of the surgeon operating, you have the robot doing it for you. We sit on the other end and we just use gestures to do the surgery. So what is the advantage of this procedure is, since it's a machine which is doing the procedure, even and the precision is so perfect, even the toughest procedure ends up being a little bit relatively simple. Basically, what we generally say is an average surgeon will end up being a good surgeon with robotics. A good surgeon will be an excellent surgeon. And for an excellent surgeon, robotics is not required.
Could you tell us more about fetal-maternal medicine?
Fetal medicine is the study where we mostly look at the interaction of the mother and the child. Now, when you look at it per se, it covers a lot of area. When you look at, say, from the first trimester point of view, that's the first 3 months of pregnancy, we can use it as a therapeutic. This medicine involves therapeutic procedures as well as diagnostic procedures. Now, diagnostic procedures per se will be a procedure where we call as chorionic villus sampling or amniocentesis, fetal blood sampling, fetal skin biopsies, all these things. And what are these procedures is, we take a piece of the placenta, or we take the fluid which is which the baby is surrounded with, and screen it for any type of abnormalities or pathologies. Now, therapeutic procedures, what we commonly do is, in the first trimester, is one thing is multifetal reduction. That is, sometimes when you take treatment for pregnancy, there will be incidences where you have 5, 6, 7 inside. Now, a normal uterus normally cannot accommodate so many children. So either we leave it like that, and sometimes as the months go by, they tend to deliver by 5th month or 6th month, and the chance of losing all the babies.
Okay.
So in such conditions, what we can do is, we will slowly reduce, or we destroy one fetus after the other, and maybe keep 1 or 2 inside, maybe you can say 2 inside, so that those 2 pregnancies can continue uneventfully till term, and the mother can deliver a healthy child. The second half of pregnancy, you have other disorders which will come, where you have an Rh negative mother. An Rh negative mother who has had a previous delivery with an Rh positive baby and has been immunized in that pregnancy. So in this pregnancy, probably the child starts getting affected. So we do procedures like fetal blood transfusions, where we inject blood from the outside into the child which is inside the mother. We can do surgeries for the child which has got spinal abnormalities like spina bifida or something like that, where with the child in the abdomen, we go open, correct the abnormalities or remove the tumors from the child, put the child back inside, close it back, and allow the pregnancy to deliver, to go to term. We also have procedures where in twins, suppose there are some kind of anomalous communications between the twins, because of which one baby is growing well and the other baby is not growing well. Then we go inside with the help of instruments. We identify the defective channels which are communicating between the 2 babies, and with the help of laser, we cut off those communications so that both the childs can develop properly. So this is what is basically a few of the things which can be done in fetal-maternal medicine.
And how do you destroy this fetus? Like you told, if there are 5 or 6 fetus.
Yeah, basically it's like a crude procedure where probably we inject a certain chemical into the heart of the baby. It's just probably this big. It's maybe in the 2nd month or so, or 2nd month. So very small fetus. So with the help of an ultrasound, with a needle, we just go directly into the heart and inject a chemical into the heart, and it just kills the fetus there itself.
Lastly, what message would you like to convey to our viewers?
Message, what I would say is probably eat well, sleep well, have a healthy lifestyle, take good care of your health. Any small symptoms or any problems that you notice, don't neglect, visit your doctor as early as possible.
Thank you, doctor. Thank you for spending your valuable time with us. It was nice meeting you.
Thank you. Thank you very much.
So that was Dr. Raghavendra Prasad with us. Until we meet next time, this is me, Anjali, signing off. Take care.